Have you ever wondered if the blood pressure medication most people assume is number one? Actually isn't. The answer surprises a lot of people. Millions of people take blood pressure medication every day, yet very few know which medications doctors prescribe most often, or why one particular drug consistently stays at the top of the list. And here's something even more important. The medication that's right for one person may be completely wrong for another. In this video, we'll reveal the 3 most prescribed blood pressure medications, explain how they work, who they're commonly prescribed for, and the side effects you should know about. Be sure to stay until the end, because the medication that ranks number 1 isn't necessarily the one most people expect. Welcome to the channel. If you're concerned about high blood pressure, you're certainly not alone. High blood pressure affects hundreds of millions of people worldwide and remains one of the leading risk factors for heart attacks, strokes, kidney disease, and other serious health problems. One of the biggest challenges is that high blood pressure often causes no symptoms at all. Many people feel perfectly healthy while their blood pressure quietly damages their blood vessels, heart, brain, and kidneys. That's why doctors frequently prescribe medications to help bring blood pressure into a healthier range and reduce the risk of life-changing complications. But not all blood pressure medications work the same way. Some relax blood vessels. Others help remove excess fluid. And some affect the hormones that regulate blood pressure throughout the body. Understanding these differences can help you have more informed conversations with your healthcare provider and better understand your treatment plan. Let's begin with the medication that consistently ranks at the very top. Number 1. Lisinopril. Many people assume the most prescribed blood pressure medication would be a newer drug or a heavily advertised brand name medication. It isn't. Lisinopril has remained one of the most commonly prescribed blood pressure medications for years. You may also recognize it by brand names such as Prinival or Zestril. Lisinopril belongs to a class of medications known as ACE inhibitors. ACE stands for angiotensin-converting enzyme. Here's the simple explanation. Your body produces a substance called angiotensin II. This chemical causes blood vessels to tighten and narrow. When blood vessels become narrower, blood pressure rises because the heart must work harder to push blood through them. Lisinopril blocks the process that creates angiotensin II. As a result, blood vessels remain more relaxed and open, allowing blood to flow more easily. This helps lower blood pressure and reduces strain on the heart. Doctors often prescribe lisinopril not only for hypertension, but also for certain kidney conditions and heart failure. It may even help reduce the risk of heart attacks and strokes in some patients. Common side effects include dry cough, dizziness, headaches, and fatigue. More serious side effects can include high potassium levels, kidney problems, severe allergic reactions, and extremely low blood pressure. Now let's move to number 2, Amlodipine. Amlodipine is prescribed to millions of people around the world and is best known under the brand name Norvasc. Unlike lisinopril, Amlodipine belongs to a class of medications called calcium channel blockers. Calcium plays an important role in muscle contraction, including the muscles found in blood vessel walls. When too much calcium enters these cells, blood vessels can become tighter and narrower. Amlodipine limits the amount of calcium entering these cells, helping blood vessels relax and widen. The result is smoother blood flow and lower blood pressure. Doctors often prescribe amlodipine for people who also experience angina, a type of chest pain caused by reduced blood flow to the heart. Because it improves circulation, it can help reduce symptoms associated with coronary artery disease. Common side effects include swelling of the ankles or feet, tiredness, nausea, stomach discomfort, and a rapid heartbeat. In rare cases, more serious side effects may occur, including severe dizziness, low blood pressure, worsening chest pain, or fainting. And now, number 3, hydrochlorothiazide. Hydrochlorothiazide has been used successfully for decades and remains one of the most frequently prescribed medications for high blood pressure. It belongs to a class of drugs known as diuretics, often called water pills. Unlike the first 2 medications, hydrochlorothiazide primarily works through the kidneys. It helps the body remove excess salt and water through urine. As the body loses excess fluid, the volume of blood circulating through blood vessels decreases, which helps lower blood pressure. Think of it like reducing the amount of water flowing through a hose. Less volume means less pressure. Doctors often prescribe hydrochlorothiazide as an initial treatment for high blood pressure and for conditions that cause fluid retention, such as heart failure. Common side effects include dizziness, headaches, fatigue, tingling sensations, and increased urination. More serious side effects can include kidney problems, severe dehydration, vision changes, and inflammation of the pancreas. So what should you take away from all of this? The most prescribed blood pressure medication isn't necessarily the best medication for everyone. Lisinopril, Amlodipine, and hydrochlorothiazide all lower blood pressure in different ways, and each comes with its own benefits, risks, and ideal patient situations. That's why treatment should always be tailored to the individual. Understanding how your medication works and knowing what side effects to watch for can help you become a more active participant in your healthcare. Remember, the goal isn't simply to lower blood pressure. The goal is to lower it safely while maintaining the best possible quality of life. If you found this video helpful, don't forget to like, subscribe, and turn on notifications for more health and wellness content. Thank you for watching, and here's to better health and better blood pressure